We're now shifting our attention to the ladies. Now, many women suffer from painful periods, which is medically known as dysmenorrhea, with more than 50% of women experiencing menstrual cramps, along with other symptoms such as lower back pain, nausea, diarrhea, and headaches. It really isn't comfortable or pleasant and can at times be debilitating. Now, we're joined today by gynecologist and obstetrician, Dr. Jason Bennett, who is here to answer our questions about dysmenorrhea and the best ways to treat it. Dr. Bennett, good to have you on the show.
Pleasure. Thanks for having me, Zoe.
Dysmenorrhea, I'll be honest with you, that's a term I have never heard before. What exactly is it?
So dysmenorrhea is the fancy medical word for a painful period. And there's basically two types. There's primary dysmenorrhea and there's secondary dysmenorrhea. So primary dysmenorrhea is when there's no identifiable medical cause for it. And secondary dysmenorrhea is when there is a cause, such as endometriosis or adenomyosis or sometimes even fibroids.
So does that mean with the secondary dysmenorrhea, it's easier to treat compared to the primary dysmenorrhea?
Not necessarily. Both can be quite difficult to treat. Primary dysmenorrhea is relatively easier to treat, but obviously if there is a secondary cause, we always have to address the secondary problem and try and fix that first.
Now, you use the word cause. Is there possibly something that can cause dysmenorrhea in some ladies?
Well, dysmenorrhea, primary dysmenorrhea, is caused by the release of this natural occurring substance called prostaglandin. Okay, and prostaglandins are released from the lining of the uterus, and it causes the muscle of the uterus and the blood vessels of the uterus to contract and cause a painful uterine contraction. And that's what causes primary dysmenorrhea. Obviously, with other causes, such as secondary dysmenorrhea, there's endometriosis. Endometriosis occurs when the lining of the tissue of the endometrial lining is located outside of the uterus, such as the ovary and the bowel, and this can cause a bit of a painful reaction. Adenomyosis is when the endometrial lining is located in the muscle of the uterus, which can also cause quite a painful sensation and definitely needs to be addressed.
I mean, as ladies, we often talk about, period pain. We have these types of discussions all along, and I really feel sorry for women that really have difficult and heavy and painful periods. Now, for someone that's maybe watching today, how do you know the difference between a normal period and that of dysmenorrhea?
So you're right, most women have some discomfort during their period. So the normal amount of discomfort is you'll have a little bit of pain 1 or 2 days before. It'll last about 3 days. It is relieved by some simple analgesia. But severe dysmenorrhea, when it's a problem, is when it's not responding to analgesia, it lasts longer, and it begins even earlier. And it starts affecting normal activities. So women often start feeling a little bit depressed. They have to take sick days. They can't go to work. And that's when it needs to be addressed.
Okay. Is that when you need to go seek a professional health care? Or when is the time to be like, you know what, this doesn't feel normal, I need to maybe make an appointment with my doctor?
Yeah, so all severe dysmenorrhea should be addressed by a healthcare provider. So when it becomes debilitating, when it's affecting their activities of daily living, also when you're experiencing heavy bleeding and also clotting, it's really important to go and see a healthcare provider.
Okay, well, you're definitely giving us a lot of insight into, something that most women will be going through. Well, Dr. Jason Bennett, thank you so much for joining us this morning, and it's a really important discussion to have.
No, it is, most definitely.
Yeah. Well, a painful period can definitely interfere with our day-to-day life and make us feel uncomfortable. BRUFEN is there to help relieve the back and muscle cramping pain, making life during that time of the month more manageable.